Hey ladies, I hope you are doing well. I'm jumping on to talk about Ozempic today. And I'm just pulling up my cheat sheet here, making sure that I am live in the right group, and we are going to get started. And the reason I decided to do this topic today is, not a lot of my clients, some of my clients have asked me about Ozempic. Some of my clients are currently taking Ozempic. It certainly is capturing a lot of attention these days in the field of weight loss. I'm having lots of conversations with women who have either tried Ozempic or are on Ozempic or are thinking about Ozempic. So I decided that it would be an interesting topic to bring to this group. I want you all to know I do not sell Ozempic. The idea is really, it's all I want to do in this training is provide you with information, the pros and the cons of taking Ozempic. I'll tell you a little bit about some of the research that's been going on within the field of Ozempic. And really, ultimately, it's because I want you to be able to make an informed decision about whether or not Ozempic is right for you. I am not for it. I am not against it. I'm going to try to present as much as possible a non-biased look into Ozempic. All right. So that's what we're doing today. This is a mini training, but I do have a lot to cover. So I expect it to take about 20 to 25 minutes. We're going to be talking about, I'm going to start by just talking about one of the longest studies that was done on Ozempic. It was a 2-year study, and I'll tell you what the results were. I'll tell you a little bit about the history of Ozempic, and what's actually inside Ozempic, which is called a semaglutide. I'll explain how it helps with weight loss. And then we're going to dive into pros and cons and some considerations that I think all women should be thinking about if they decide that Ozempic is the right choice for them. Once again, I do not sell Ozempic. I am literally just giving you some information. So I can see that some of you have already joined me live. So if you are watching me live, put a live in the comments and let me know, what is your interest with Ozempic? Are you taking it? Are you thinking of taking it? Have you tried it and you hate it? You tried it, you loved it? Just give me a little bit of a sense in the comments. If you are catching this on replay, put a replay in the comments and let me know that you are here. Okay, so I guess the first thing I'm going to say is, should you take drugs to lose weight, right? Like, this is a prescription drug. It's quite a strong prescription drug. So should you even be taking it in the first place? And ultimately, there's sort of like, if you go inside the weight loss field and you look at the different experts, you're going to see that there's really two opinions. Typically in the field of nutrition, there's always two opinions, and they're typically very polarized opinions. So one of those opinions is that Ozempic is a Band-Aid solution, right? It's a Band-Aid solution in the sense that it's not addressing the underlying issue of what caused the weight gain in the first place. And for the people that have that opinion, that Ozempic is a Band-Aid solution, their sort of idea is that really women should be addressing nutrition, lifestyle, and exercise in order to lose weight, as opposed to taking a drug. That's one opinion. The second opinion is that obesity is a disease, and therefore a drug is needed in order to treat that disease. So that's much more of a sort of like a Western medicine approach to it. And for the people that are in that sort of opinion, the belief is that exercise and nutrition are not sustainable and don't work for a lot of people. In reality, I think there's truth to both of these sort of opinions or beliefs. I tend personally, I'm more on the side of thinking that Ozempic is a little bit of a Band-Aid solution, but at the same time, I'm trying to be open to potentially combining Ozempic with nutrition and lifestyle modifications, especially for women who really have been trying their hardest and are just really, really struggling to make any changes, any nutrition or lifestyle modifications that will lead to weight loss. So just to give you a little bit of a sense of like sort of where I'm coming from when I'm talking about Ozempic. So I want to start by talking about the study, and I'll put a link to the study inside the notes for this mini training so that you can go and see it for yourself. But there's these trials, they're called the STEP trials, and they're all about research into semaglutides and sort of how efficient they are. There's been 5 different trials. This is the 5th trial. It's called the STEP 5 trial. And essentially it's the longest study ever conducted on the weight loss drug semaglutide. So it's not necessarily Ozempic. It's the drug that is in Ozempic, which is semaglutide, which I'll explain what that is soon. But essentially in these different studies, they were using 2.5 milligrams of semaglutide, and this gets injected into your subcutaneous fat once a week. Okay. So if you're wondering like, well, how much do you need? That is what they are using in clinical trials. And that's a really important number to know because, you know, a lot of times when there's research into drugs and supplements, you need to understand what is the effective dose that's being used in the research. So it's 2.5 milligrams. That's what they use in the research per week. Now, again, in this particular study, they did a 2-year study of the effects. There were just over 300 people that participated. Most of the subjects were female, which is very interesting because a lot of times nutrition studies are not done on women, and their average age was 47. So it kind of really fits with the demographic that's inside this community, because I know I have a lot of women between the ages of like 40 and 60. Average body weight when women started was 233 pounds. So they were using this drug on women that were considered to be obese or overweight, not women who wanted to lose 20 pounds. Very different. Okay. And we'll talk about that in a little bit here. And again, they gave them, what they did is they split these women into 2 groups. One group got the semaglutide, like the drug, and the other group got a placebo. And if you don't know what a placebo means, it means that you get the injection, but you have no idea if you're getting the real thing or the fake thing. And then on top of the medication, these the subjects, men and women, they were given some coaching, so some counseling. They were told to reduce their caloric intake. They were told to do some exercise. The results, because this is what we want to know. Ultimately, semaglutide, this drug, outperformed the placebo, which was no drug, quite significantly. So what I'm basically saying is, yes, it works. And I'm going to explain to you how it works once again, and we're going to talk about the pros and cons, but the research definitely shows that semaglutide, aka Ozempic, works. So just to give you a couple of the numbers, the women who were taking semaglutide lost 35 pounds on a 500 calorie deficit. The women that were, or the men and women on the placebo, lost 7 pounds. So that's a big difference between 35 and 7 pounds. Okay, big difference. And then their waist circumference also changed quite significantly. So those taking the drug lost 14.4 centimeters. Those that were on the placebo lost 5.2. So once again, quite a difference between Ozempic and those that were not taking anything. And if you're just joining me, I see there's a bunch of you hopping on. Just put a live in the comments, say hello, tell me where you're from. And I want everyone to understand that I do not sell Ozempic. I am literally just giving you information so that you can make an informed decision, okay? So the research certainly shows that Ozempic can make an impact. But now I want to explain to you like like how this drug works. And I want to talk to you about the pros and the cons, because again, I think you really need to understand what's going on here before you decide to like be like, oh my God, they lost 35 pounds. I'm in, give me the drug. Okay. So number one, so the drug itself, again, it's called semaglutide. It's sold under the name of Ozempic. The other brand is Wegovy. I don't know if I'm saying that properly, but Wegovy. It was initially approved under the name Ozempic as a treatment of type 2 diabetes. But because it helped with weight loss, it became approved as a drug under the name Wegovy as a weight loss drug, but not until 2021. So this is pretty recent. This is like 2 years ago. So how does it work? Basically, what it does is it makes it really easy to be in a caloric deficit. And it does that in two ways. It suppresses, or I guess it's in one main way, it suppresses our appetite, is essentially what's happening here. So women, and I'll explain exactly how this works, but what happens is when women take Ozempic or semaglutides, they're not hungry. Their cravings go away, they suppress their appetite, and so it's very easy for them, for women and men, to create a large and a sustained caloric deficit, right? So let's say 500, 1,000 calories less than their body needs for an extended period of time without feeling hunger and cravings, which if you've ever been on a diet, this is pretty cool, because what typically happens when you go on a diet, if you do not have the assistance of a drug, what happens is that after about 4 to 6 weeks, you experience what's called metabolic adaptation, where your body is like, excuse me, please feed me. And your body literally starts to work against you, and it drives hunger and it drives craving, because it's literally willing you to go and eat, because your body does not like to be in a deficit. Whereas what happens when you're taking semaglutides is that women, a lot of women will say that they literally do not feel hungry. And I have worked with some of these clients that are just like, I'm just not hungry, because they are on this drug. So again, the main benefit and why it helps so much with weight loss is that it allows men and women to be in a sustained caloric deficit, and a quite extreme sustained caloric deficit. Okay. So here's the cool thing, and I did not know this about semaglutides until I started doing some of my own research into it, but it actually mimics one of our hormones. And the hormone that it mimics is called glucagon-like peptide 1, which I will now refer to as GLP-1, because that is a mouthful. So GLP-1, again, this is a hormone that our body naturally produces. And what GLP-1 does is it's produced in 2 different areas of the body. Partially, it's produced in our digestive system. Partially, it's produced in the brain. In our digestive system, how it facilitates weight loss is because it stabilizes blood sugar levels. Hence why it was developed as a means of treating type 2 diabetes. So it does this in a couple of different ways. Number one, it stimulates the production of insulin, and it increases the uptake of glucose into our muscles, okay? So glucose, like blood sugar, like sugar in your bloodstream, we don't want that to be elevated all the time. That's what causes type 2 diabetes. And so what it does is it stimulates the production of insulin, which takes that glucose and pulls it into the muscles. And when you have insulin, just so you know, insulin is a fat storing hormone. It signals to the body to store energy. So when we can get those insulin levels when we can drop sugar and we can drop insulin, then we send a very different signal to the metabolism. The other thing that it does is it decreases the production of glucose in the liver. So our liver can produce glucose or sugar to raise our blood sugar levels, and it kind of suppresses that action. And then finally, it also slows down gastric emptying, or how quickly we digest food, which just means that we're not going to see these big spikes in our blood sugar levels. So it stabilizes blood sugar. Just think of it as that, okay? The other thing that it does in the brain is it regulates appetite by creating a sensation of fullness. Okay. Again, super key when it comes to being in a caloric deficit, because as you know, if you go on a diet and you try to restrict your calories, you get hungry, and it's really hard over time to ignore that feeling of hunger. So why not just take GLP-1, right? Which is this hormone that our body produces naturally. So the way that I like to think of this is that you can think of semaglutides, Ozempic, whatever, as GLP-1 on steroids. And I'm not going to get into I'm not going to use all the nerdy science here, but basically when there's this thing called the half-life of a drug, which is how long it lasts. And what it basically boils down to is that semaglutides, which essentially mimic GLP-1, the effects last way longer. So GLP-1, the duration or the effect of GLP-1 when our body creates it, the half-life is 2 minutes, whereas the half-life of semaglutides is 7 days. So 2 minutes on one side, 7 days. So you can see it's kind of like I said, GLP-1 on steroids, because the effects are amplified and they last very long. This is why women have to get injected every 7 days, because that is the half-life of the drug. Okay. So I've kind of explained to you like how it works and what's happening inside the body. Now I want to jump into the pros and the cons of Ozempic. And again, I'm going to try and remain as unbiased as possible. And I'll kind of give you a sense of who I think this might be of value to and who I don't think it's going to be of value to. So potential pros of taking Ozempic. If you've been joining me, if you've been watching from the beginning, and I kind of gave you the facts about semaglutides, it's very clear from the research that it does assist with weight loss. And in fact, it can produce rapid weight loss. And this is, again, because it's helping men and women go into a deeper and more prolonged caloric deficit without having that hunger and without having those cravings. And that's the other sort of pro, is this appetite suppression. That's the pro of semaglutide. The research shows that it works and that it can be of massive assistance to women. Now, what kind of woman? So I think that this is where we need to figure out, like, who is it for? And I can think of some of the women that I've worked with in the past that have tried their very darndest to change their nutrition and lifestyle habits, but mainly nutrition, because that's what we're talking about. And they're trying to make healthy choices, but they can't. And you know, some women refer to this, and this is what it's referred to in the literature, is that there's almost like this noise in their brain, this constant noise. It's like, eat the chocolate, eat the chips, eat the donuts. And what I think Ozempic can do is turn that noise off and give women the support that they need to be able to stop eating the food. And for I think women who have a lot of weight to lose, where that extra weight is not just about looking good in a bikini, but it literally is having a detrimental impact on their health, then maybe there is a place for Ozempic. Okay. Maybe these women do need the support of a drug along with some coaching to assist with the weight loss. Now I want to talk about the potential cons and concerns of taking semaglutides, Ozempic, whatever it may be. Number one are the side effects. So, and there are a couple of women who commented on this in my sort of like my little announcement yesterday. So some of the side effects: nausea, diarrhea, vomiting, constipation, stomach pain, headaches, fatigue, indigestion, dizziness, bloating, belching, hypoglycemia, gas, and acid reflux. And so there's some, you know, there's some serious side effects here. The 2-year study that I mentioned at the beginning, The interesting thing is that barely anyone dropped out despite the side effects, probably because they were seeing results. And one woman commented that, yeah, the side effects suck, but your body eventually gets used to it. So, but there are side effects, and I think you need to understand what those side effects are. The other one, and this is purely vain, but it is in the literature, so I'm going to put it out there, because this drug for a lot of women produces rapid weight loss, which I know you're all like, yes, that's exactly what I want. For a lot of women, when you lose weight very rapidly, you can lose a lot in your face. In fact, in the literature, they call it Ozempic face. And again, this is purely vain, but understanding that, when you're losing a lot of fat in your face, especially over the age of 40, it could also mean more wrinkles. Totally vain, but I'm just putting it out there so that you know. Okay, but now let's get into like something a little less vain that's really, really important. One of the sort of potential cons is that it suppresses the desire to eat so strongly that some women have almost no desire to eat. And eating is normal. We need to be eating. We need to feel hungry some of the time, because if we're never eating, that's also not good. And we're going to talk more about that. So to me, the suppression of appetite is a pro and a con. And it's a con when it's to the point that women just aren't interested in food whatsoever. Because then what happens is women really eat way less than they should if they're not working with a coach. And this can have some detrimental effects, which we're going to talk about. So one of the most predictable outcomes of rapid weight loss is that a large proportion of that weight loss comes from lean muscle mass, right? So when we want to lose weight, we don't actually want to lose weight, ladies. We want to lose fat, because when you are losing, there's two ways of losing weight, the right way and the wrong way. The right way is where you are trying to protect lean muscle mass, your muscles, as much as possible in a weight loss phase, because that muscle is very metabolically active, and it's going to give you, it's going to help with your overall metabolic rate. And this is key for when you get off the drug at the end. If you have lost a lot of your muscle tissue, then your metabolic rate will slow down. And again, in the comments from yesterday, some women were saying that they know women who've been on Ozempic, and then after they got off it, they gained the weight and then some. This is why. This is why. Or it's one of the reasons why, is because if you are losing a bunch of weight, but a big proportion of that weight is coming from muscle, then this is not a good thing. And I'm going to read to you two little quotes from some weight loss experts out there. One is Dr. Bill Campbell, who's a PhD who basically has devoted his entire life to fat loss. And he wrote, while those with obesity can achieve considerable health benefits from fat loss, the potential benefits of fat loss among healthy weight individuals are minimal and are unlikely to offset the health risks associated with reduced lean mass. Okay, that's a mouthful, but what he's basically saying is that if you are a woman who is quite overweight or obese, and that fat is causing you to have health risks, get the fat off, even if that means that you're losing some muscle mass at the same time, because that's going to have more of a positive effect on your longevity and your overall health. But if you are a woman who has 30 pounds to lose and you want to look good in a bikini, and you're going on Ozempic just to lose the 20 to 30 pounds on the scale, and you don't care where that number comes from, you are setting yourself up for health implications because you are losing muscle mass, and that is not good. Peter Attia, he is also a physician, but also a host of a podcast called The Drive. And he said, almost every patient we put on this drug has lost muscle mass at a rate that alarms me. This is huge, ladies. Like, I cannot overstate that you need to understand the potential risk of losing muscle mass while losing weight on this drug. And one of the step 5 studies that I told you about at the beginning, one of the studies looked at body composition change and where the weight loss was coming from. And the weight loss was 61% fat, 39% lean body mass. That is a lot. Okay, we do not want that. We want to minimize lean body mass losses as much as possible. And again, what happens is that, you know, when we are losing muscle mass, we are going to see negative metabolic adaptations. We're going to see a slowing down of the metabolism. And when you finally get to your goal, or you get off Ozempic for whatever reason, if you have a slower metabolic rate than you did when you first started, and you are unable to control your caloric intake, you will gain the weight, and you will likely gain even more because now your metabolism is running at a slower pace. So this is a huge thing to take into consideration when you're deciding if this is the right fit for you. And another thing for us, specifically as women in our 40s, 50s, and 60s and 70s, is the sarcopenia, right? So we are already prone to sarcopenia, or age-related muscle mass loss. And this is just kind of like a slap in the face, right? So we have to be very, very conscientious of this. And I'm going to talk about what we can do to be proactive if we decide to go on Ozempic with that understanding, okay? Now, the last sort of thing that I want to talk about here of like the pros and the cons and who this may or may not work for, and this is for my ladies that are out there that are already watching their calories, because I think that this is the group of women that's trying to take Ozempic to lose weight because they've tried it all and nothing is working. And maybe their doctor doesn't fully understand how the metabolism works, but their doctor is like, try Ozempic. Or maybe the women aren't fully being honest with their doctors, but women who are already, eating 1,000 calories a day, and they're professional dieters and they've been dieting for the past 20 years. Your problem isn't that you need to eat less calories. Your problem is that you need to eat more calories, because you're basically in what we call starvation mode. So going on Ozempic and further suppressing your appetite and dwindling down to 500 calories, it's not going to help. And I don't think this is the right drug for you. I think you need to do quite the opposite. And I think you need to eat more food as opposed to less. That is a topic for another day, but I just want to put that out there and make sure that it's clear. Okay, so last little piece here. I'm going to wrap this up pretty quickly. I know I've been talking for almost half an hour, but lots to go over here. But I want to talk about some nutrition and dietary considerations that I think women need to be thinking about if they want to, if they decide, or if they're curious about taking Ozempic. Number one, I truly believe that it needs to be in conjunction with a comprehensive approach that is, addressing your nutrition, addressing your macros, addressing resistance training, addressing stress management, addressing sleep, addressing mindset. You do not want Ozempic to be a Band-Aid solution. You want it to be an additional layer of support that will help you to make the necessary changes to keep the weight off. So I want to make that super clear. It's not like you can just take Ozempic, not care about how you're eating, not care about your exercise, lose a bunch of weight, and never gain it back. Because if that's your approach, you're just wasting your money. You need to make sure that if you're going to take an Ozempic, you are either seeking the help of a coach or you're doing it by yourself, but you need to make changes. You need to address the root cause. This is not addressing the root cause. It's just assisting in the weight loss. It has to go hand in hand with healthy eating. And I would even argue that because with Ozempic, you are going to be eating way less calories naturally because it's suppressing your appetite. Every single calorie counts, right? And I say this to my clients when I am calorie cycling with them and I'm putting them on low calorie days. those are the days where I'm like, protein is extra important. Your vegetables are extra important. You still need to get the vitamins and the minerals and the micronutrients that your body needs. And when you're eating less food, you can't be picky and choosy about where you're getting. Like, you have to be very, very strategic about every calorie going into your body. The second thing, going back to the loss of lean muscle mass that I explained. If you are going to do Ozempic, you need to make sure you are doing two things. You are eating a ton of protein, more than you think you should be, and you're doing some form of resistance training, because you have to double up on preventing lean muscle mass loss more than any other woman if you're doing Ozempic, because you're naturally probably going to eat less calories. And what's going to happen? Like I said, you don't want your body losing 40% of your weight from muscle mass. So you've got to eat a ton of protein, and you have to make sure that resistance training is your go-to exercise method. I would personally, once again, I would highly recommend that you work with a coach. If you decide to go on Ozempic, make it count. Make it count. Work with a coach that can teach you about macros, a coach that can help you make sure that you're getting adequate amounts of protein at breakfast, lunch, and dinner with every single meal, right? Like, super, super important. And someone who can help you with that resistance training. It's just, you can't just take the drug alone. And then the last thing, and this is super important, and I can't go into a huge amount of detail right here, but if you are going to go on Ozempic, you need an exit plan, okay? If you've been following me for a while, you know that I am not a big fan of linear dieting, where you just go calorie deficit, calorie deficit, calorie deficit, and then boom, you're done. Non-linear dieting is like, just means that you're being a little bit more strategic about the whole thing. You have an understanding of how your metabolism is changing as you're dieting. And an exit plan, sometimes I call it a reverse diet, where instead of going from like, I'm done with Ozempic and now I'm just going to start eating normally again, a reverse diet basically means that you are slowly reintroducing calories and you are slowly upregulating your metabolism. And if you're on Ozempic for a year, plan to reverse diet for a year, because if you're going to downregulate your metabolism on Ozempic, you need to give your metabolism time to heal before you can get back to eating normally. Okay. So a bunch of different things to just think about here. Again, I don't sell Ozempic, but I do offer coaching. So, you know, if Ozempic is something that you're thinking about and you want to do it with the assistance of a coach, I currently have 2 spots in my private coaching program. I have 2 spots. I'm about to open up a couple more. Would be happy to jump on a call with you to discuss what that looks like, how I might be able to help. But whatever you do, just please, 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 you know, understand that there are some serious implications to taking Ozempic. It doesn't have to be me. I don't have to be your coach, but I would highly recommend that you work with a coach if you decide that Ozempic is the right choice for you. I really hope that was helpful, ladies. Thank you so much for joining me today. Some of you asked, is there going to be a replay? Yes, there will be. I always pin all of the trainings to the featured section. So if you go back to the main group and you just go and scroll to the top menu and look for featured, all of my mini trainings go there. I'm going to be jumping on again next week to talk about another research. This one was done specifically on women post-menopause, and we're going to be talking about protein because it's one of my favorite topics. But thank you again for watching. Have a wonderful day, and I'll see you soon. Bye.